Hello, my name is Adam. This is my bsn205 colostomy care video. For this, I need a few things: my scissors to cut the barrier for the new colostomy ring, something for hand hygiene, a couple gloves, a wash bin with a towel with warm water or warm soapy water, my ostomy ruler kit, my stoma pretend patient, and something to put underneath them, and as well as my ostomy bag and the barrier ring and the adhesive. Since I only have the one, I'm going to pretend that it's on and not actually stuck to them when I'm taking the old one off, and then actually cutting it and applying the new one on afterwards, like the instructor said in the EL video. So I've gathered all my things. I'm going to go into the patient's room. So I knock on the door, enter, and close the door for their privacy, and ask them for their name and date of birth, which they provided for me. So I'm going to be caring for your colostomy area, and I'm going to check and see how your skin's doing and assess how your stoma is looking, as well as changing your colostomy bag and putting a new barrier and ring on there. If they have any questions, this would be the time. So I would use some hand hygiene and put some gloves on and put something underneath them, and then first would take off the bag, and if it was liquid stool, I would measure the amount, or if it was solid stool, I would measure its consistency and then dump either one and then throw away the bag. Let me just kind of get this so you can see what I'm doing. So I'm going to put this underneath my patient, and then, like I said, we're just pretending that the thing is on right now. So I would take off the collecting bag at first, off of them, and then, like I said, I would dump what was in here or measure what was in here and then throw that in the biohazard bin, and then very carefully pull this off of my patient and making sure that I'm not causing any skin tears, and looking to see if there were any leakage or skin irritations from the barrier being messed with. And then this patient's skin is looking good. I don't see any extra redness or any irritation. The stoma itself is looking nice and red and pink. It's not blue, which would be signs of necrotic. So I'm going to use some warm water and just kind of clean the stoma. And then I would be just kind of patting it dry, making sure everything's looking very nice. And then if I had any skin barrier cream or like an adhesive protectant, I would use that around the patient before putting the new one on, but since this is just cardboard, I'm not going to do that. And then I'm going to use this ostomy ruler. Since it doesn't have holes in it for me to kind of accurately measure the stoma with just putting it into the holes, I'm going to use this ruler on the side to measure the diameter to determine how much I'm going to cut of the adhesive ring. And it's looking to be about 2 inches, and I'm just going to verify with this 2-inch one and see if that hole is looking about the same size as that stoma, which it does. So I'm going to use my scissors, my safety scissors, and cut the ring out where it says 2 inches, which is the max. So it's going to be right on the border here. And before I end up actually doing that and going too far, I'm going to take these gloves off, since I had been touching that old stoma or that old ostomy bag, and I want to put some new ones on when I'm getting this nice clean. Okay. So with clean gloves, I'm getting this cut. And if I had any skin protected adhesive pad protecting, I would use that on the skin just to make sure it doesn't cause any irritation. And I would want to make sure that this doesn't have any hard edges or sharp edges that might cause irritation to the patient while this is on as well. And I'm just going to kind of see how we're looking, and it looks pretty good. Alright, so I'm actually just going to get this first part of the adhesive on, make sure that I have a good seal. I'm not touching the sides of the stone with it, and it has a nice room to breathe. And then I'll get the rest of the backing off as well. And then I'd put the bag on. Just making sure there would be no possibility of leaking. That would cause irritation. And then I'll put my bag on the sides. Be careful where I'm applying pressure. And making sure that it's closed, because that would suck to do all of that work and have the bag open. And I will clean up everything that I have and position my patient so that they're nice and comfortable. Take my gloves off, use some hand hygiene, and document the change of the bag and assess the skin and make sure that my documentation is complete. Thank you very much.